Now, Nigeria needs to strengthen and revitalize the primary health care in the country. These were the words of Director General Cross River State Primary Health Care Development Agency, Dr. Betty Edu. Kelly Egiga tells us more.
Nigeria has a National Primary Healthcare Development Agency which was set up in 1992 in response to the 1978 Almaty Protocol on Primary Health Care. Tackling community health, preventive and curative medical challenges are some of its goals, but sadly, the implementation in Nigeria has been a mishmash. Speaking with the Director General, Cross River State Primary Healthcare Development Agency, Dr. Betty Edu, who said Nigeria has not made a lot of progress in improving primary health care.
Nigeria has not made a lot of progress in improving primary health care. In fact, the pyramid, the health pyramid, which should have primary health care as the base, a very big base, and then you now have the secondary health care and then the tertiary health care, has actually been turned the other way around. So more people go to tertiary institutions, specialist institutions, than they go to primary health care, and that's not supposed to be the situation.
Speaking further on the ways forward for primary health care in Nigeria, Dr. Edu advocated for funding through Basic Healthcare Provision Fund, ensure insurance under the State Health Insurance and the Nigerian Health Insurance Scheme, among others.
The way forward is for Nigeria to put its money where its mouth is. First and foremost, we must strengthen the primary health care by providing funding for it through the Basic Healthcare Provision Fund. We should also ensure that everyone is insured under the state health insurance and the Nigerian health insurance scheme. That way, capitations are being paid to primary health centers. They can be able to hire the staff they want on contract basis. They can be able to run their drug revolving fund, buy consumables, maintain the health centers, and run an integrated program for everybody who comes through their door. So really, I think there should be more done to coordinate and better implement health services at that level. 80%, I repeat, of diseases, issues that people have, health challenges, can be handled at that level. And of course, they are the closest to the community. So if you strengthen the primary health care, then you strengthen the link with the community, and people are healthier, the population is healthier.
Presently, most of the primary health care facilities in Nigeria lack the capacity to provide essential healthcare services, in addition to having issues such as poor staffing, inadequate equipment, poor distribution of health workers, poor quality of healthcare services, among others. Strategies and constraints in the implementation of the Almaty Declaration has led to the state of things, and one can only wonder the fate of Nigerians in rural communities. Kelly Egiga, Galaxy Television News.